Dementia does not discriminate, so it does not matter how bright a person you are, or how much life experience you have, or what your occupation may have been. Everybody is at risk of developing dementia as they get older.
Seniority Authority exists to answer your questions on aging. The world has changed dramatically in a generation, with more retirees than ever before, living longer, with more choices. If you're an older adult or have an older adult in your life, where do you go to begin to understand those choices? I'm your host, Kathleen Toomey, with over a decade of work experience in retirement communities. I can track down the right people to answer your questions. So send your questions on aging to me, and together, let's get smarter about growing older. Perhaps the single greatest fear that people have around aging is memory loss. And for good reason. The older we live, the greater our chances of getting dementia. 32% of adults over age 85 have some form of dementia. But what if I told you there were changes you could make now to reduce your chance of getting dementia by 50%? In today's episode, we are going to do just that. Dr. Maureen O'Connor, an assistant professor of neurology and board-certified clinical neuropsychologist, will share research and practical tips you can do today to strengthen your memory. Dr. O'Connor is the Director of Research Education at Boston University's Alzheimer's Disease Center and Director of Neuropsychology at the Bedford VA Hospital. Author of 2 books, the first, 7 Steps to Managing Your Memory, and the new book, 6 Steps to Managing Alzheimer's Disease and Dementia, A Guide for Families, is available for pre-order. Both books are designed to help people understand and treat memory loss and aging. If memory loss is a concern of yours, stay tuned for today's episode. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of nonprofit retirement communities, where active adults find community, purpose, and peace of mind. Visit riverwoodsgroup.org. Now, let's hear from today's guest. Welcome to Seniority Authority. I'm your host, Kathleen Toomey. Perhaps the single greatest fear that people have around aging is their memory, and for good reason. The older we live, the greater our chances of getting dementia. But what if I told you there were changes you could make now that reduce your chance of getting dementia by 50%? Today, we're going to learn more about lifestyle changes from our guest, Dr. Maureen O'Connor. She is an assistant professor of neurology and board-certified clinical neuropsychologist who is going to share her research and practical tips on things you can do today to strengthen your memory. She has a lot of great experience. She's the director for research education at Boston University's Alzheimer's Disease Center, and she's a director of neuropsychology at the Bedford VA Hospital. She co-authored 2 books. The first, 7 Steps to Managing Your Memory, and the second, which is available for pre-order now through Amazon and will be available this summer, is 6 Steps to Managing Alzheimer's Disease and Dementia, A Guide for Families. Dr. O'Connor's got a tremendous amount of experience working with individuals and their families, and she's going to help take us through how we can understand the aging brain and what we can do from a lifestyle perspective to help strengthen our brains. I have been working with Dr. O'Connor for a number of years, and she is so delightful and so succinct at explaining in layman's terms what happens to our brain. It's so great to see you again, Dr. O'Connor.
Thank you for having me here.
Well, thank you so much for joining our podcast. You've educated hundreds and hundreds of people on this area, which so many people are afraid of. And I just wanted to know what first inspired you to focus on this area of medicine in particular.
Well, I first became interested in neuropsychology because I wanted to work with patients that had traumatic brain injury and stroke. And then I had the experience of working in a dementia clinic, and I developed an interest in working with older adults. But the common thread in all of my interests and research has really been finding ways to help patients and families navigate these transition periods when life is disrupted by injury or illness.
That's fantastic, and that's so important. And I'd love for you to take us on a very quick journey about the brain. Can you tell us, layman, when does a brain start to age? And is it inevitable that we will have memory loss as we age?
Sure. So maybe surprisingly, the brain starts to age in our 20s and 30s. So shortly after
Yikes.
it's reached maturity, earlier than one might expect. And no, no is the sort of short answer. It is not inevitable that people will get dementia as they get older. There are many people that live well into their 80s, 90s, and hundreds that have no cognitive decline.
So, how would you explain why some people have cognitive decline and some people don't? I know, in particular, a lot of people that I know who are very intelligent are upset at the fact that they have dementia because they think because they are smart, then their brain will not betray them, as it were. What's the typical understanding of why dementia attacks some folks and not others?
Yeah, dementia does not discriminate. So it does not matter how bright a person you are, or how much life experience you have, or what your occupation may have been. Everybody is at risk of developing dementia as they get older. Uh, the cause for dementia is largely unknown. So we don't know exactly why some people develop dementia while other people don't. What we do know is that having a family history of dementia slightly increases our own risk of developing dementia about 2 to 4 fold. So, if we imagine that individuals that are 65 to 75 have a 1.5% chance of developing dementia without a family history, for those that have a family history, they are 3 to 6% at risk for developing dementia. But again, it doesn't mean that developing dementia, even with a family history, is inevitable.
Okay. And I jumped into this conversation, but one thing that I know people ask me all the time is what's the difference between dementia and Alzheimer's? And so, can you walk us through that before we get further into our conversation? Just break it down for us.
I certainly can. It's a very common question. So, the term dementia refers to three sort of things. It's a very broad term that means that a person or somebody involved in that person's life have noticed that there are changes in memory and thinking, that on formal tests of memory and thinking, there is a decline relative to age. So the person does not perform normally relative to their same age peers. And that those changes in memory and thinking are causing that person to have problems doing things in everyday life that they used to be able to do independently. But the term dementia does not tell us about the underlying cause. So it's sort of like saying that somebody has a headache. A headache can be due to stress, it can be due to a pinched nerve, or even something like a brain tumor. The question one has when they have a headache is why? And the question one should have if they've been told that they have dementia is why? What's causing it? Alzheimer's disease is the most common cause of dementia over the age of 65.
And so that's probably why people tend to say Alzheimer's, like people refer to tissue as Kleenex.
That's right. That's right.
It's just one form of dementia, but the most prevalent form of dementia. And can you tell us a little bit about the chemistry of the brain and the plaques and tangles that we hear about that are evidence of some form of dementia?
Yeah, so in Alzheimer's disease, the histopathology or what we see in the brain are plaques and tangles, and plaques are like sticky sort of substances in the brain, for lack of a better way to describe it, and tangles are said to be the sort of indications of cell death. And both of those things are found in the brains of individuals that have Alzheimer's disease.
But as I understand it, there's no way that you can do a test to understand you. The way that you would determine that you have some form of dementia are more cognitive, traditional cognitive tests. You're not examining the brain in any way or doing brain scans to see these plaques and tangles, or is that incorrect?
So that is incorrect. So there are many different methods that are used to diagnose dementia. As a neuropsychologist, what I do when I have a person in my office that is worried about memory loss is to administer a number of pencil and paper tests of memory and thinking that I then compare to people their same age from similar backgrounds to see if they are performing where I would expect them to be. And then I examine what areas they're performing worse than I might expect them to be. And I put that together with the history that I've gathered from the patient and often a family member to try to sort of best understand what might be going on with them, what the diagnosis might be. But I also take advantage of my ability to refer out to my colleagues in neurology and radiology so that additional testing can be done that can help to support a diagnosis. So, for example, we order things like an MRI of the brain to look for specific patterns of brain atrophy that might support a diagnosis of Alzheimer's disease. There are new imaging techniques that can actually help us to see the plaques that are in the brains of patients while they are still living. And so, we would not use those methods on every patient, but those methods are certainly available to us. We are also able to draw cerebrospinal fluid from patients so that we can look for evidence of the tangles that are in the brains of patients with Alzheimer's disease through cerebrospinal fluid analysis. So there are a number of things that we can do to help to diagnose dementia.
And I'm sure that more and more come out every day.
More and more is being developed to help us in these areas, to help to diagnose importantly as early as we can.
So let's say you're one of the listeners to our podcast and you're worried about your memory and you have a history of dementia in your family, in your 40s, 50s, what would you advise someone to do who's worried about that, who has a history? And does that differentiate from what you would advise someone to do in terms of testing now compared to somebody who doesn't have a history but is just petrified of memory loss?
Yeah. So I would not have different advice for for those groups of individuals. What I would recommend is that anybody that is concerned that there are changes in their memory or thinking should start by talking to their healthcare providers about their concerns.
Mhm.
There are in office screening measures that healthcare providers can do on the spot to help to understand whether there are objective findings of memory loss. And then healthcare providers can refer out to specialists as they feel it's appropriate. And then they can also follow their patients over time and check in at annual visits to see how things are going, whether somebody feels like their memory has continued to decline over time, to help better direct them towards additional testing that they might need.
So I think that's encouraging because it sounds like if you're worried, you can express that to your healthcare provider and get a simple pencil and paper test that's not extensive, it's not expensive, and it can give you a baseline. And that's something that you can then take that and then get more information.
Yeah, so the concern can be immediately addressed in a doctor's office with a cognitive screen that can help somebody understand whether the problems that they're noticing are noticeable on formal testing. There are some individuals who formal testing may be less useful, so sort of formal cognitive screens in a doctor's office that should be referred out. So, for example, for individuals that are very bright, there may be really minor changes that would be most noticeable on more comprehensive testing. And so, in some instances, somebody like a primary care provider may decide that even if a cognitive screening measure looks normal, they would prefer to refer out for more comprehensive testing anyway. But it is definitely a place to start.
I am really looking forward to your next book, but I have loved working with you and reading and understanding your initial book, The 7 Steps to Managing Your Memory. And what I loved about that book is how hopeful it is to those of us who want to do something to help strengthen our brain. So many of us are, we're working out and we are eating healthfully and we're trying to get sleep and we're trying to work with nutritionists, and people are very focused on how to be healthier. And what I really loved about your book is it's very proactive, saying if you have a concern about memory, here are some lifestyle things that you can do now to help improve your memory, your strength. And it's so accessible. Can you talk about a few of those and what you think are really important?
Sure. Yeah, so there are a number of lifestyle factors that can impact the way that our brains age, including things like diet and exercise and sleep. Also, things like the way in which we manage emotional and medical issues. And there is certainly research that suggests that making changes in these areas can help our brains to age more successfully.
And of those, diet and exercise, The question that I always get, that you always get, is what about the brain games? And I'd just love you to answer that question, because we get that question every time you come in and speak to adults. So, what about brain games?
Yeah, it is a popular question. So there is uh, no really strong and consistent evidence that these brain games really help to prevent somebody from getting dementia. Uh, what the research tends to show is that people that engage in these brain games might feel better about how they're doing. So they may sort of self report that they're doing better. They may get better at the actual game itself. But the research does not strongly support that there is any generalization to improvement in day-to-day life or any structural improvements in the brain. So for now, we usually suggest that people save their money and invest their resources, money, and time into doing things that we know are good for the brain. Things like joining a gym so that one can exercise, or buying a pair of sneakers, going out with friends to socialize, enjoying opportunities to go to museums or engage in other cognitively stimulating activities.
And I would love for you to explain to our listeners the two things you just talked about. One is exercise. So, can you explain the connection between exercise and the brain? How does exercise help us keep our brain strong?
Sure. So there are really so many ways in which exercise helps us to keep our brains healthy. And when I talk about exercise, I'm really talking about aerobic exercise. Aerobic exercise can help our brain stay healthy because they can do things like help us to improve our mood, things like depression and anxiety. Exercise also helps us to improve health conditions that can impact the brain, things like diabetes, high blood pressure, high cholesterol, obesity that put us at risk for heart attack and stroke. And exercise also has a direct impact on the brain. We now understand that aerobic exercise can help us to grow new neurons in the brain, particularly in the hippocampus of the brain, the memory centers of the brain. So there are both indirect ways in which exercise helps our brain through helping our mental and physical health, and direct ways in which exercise helps our brain by helping to increase the functioning of our brain and increase brain cells.
That sounds like a great uh, recommendation, that if you exercise, you will grow more brain cells. So let's go a little bit deeper, because I know people are always like, okay, exactly what do you mean by aerobic exercise? And is walking the dog count? And does gardening count? Can you drill down a little bit and give us some more specific prescriptions on that?
Yeah, sure. So walking the dog and gardening, might count is the answer. So the current recommendations are 150 minutes of aerobic exercise a week, which is about 30 minutes, 5 days a week. And we usually use that as a starting point for our patients. And this can be any activity that gets our heart pumping, where we may feel a little sweaty, or we may be breathing a little bit heavier. It doesn't have to be, that we're sort of out there running a 6 minute mile, but just that we're getting our heart rate up. And so that can be accomplished by walking the dog, or doing some very vigorous gardening. or engaging in activities like swimming or riding a bicycle, anything really that helps to elevate our heart rate.
Awesome. Okay. Minimum 30 minutes, elevated heart rate, 5 days a week. Okay. If you want more brain cells, that's what you need to do. So, the next thing that I find really fascinating about your research is the power of social connections and the power of socialization in strengthening our brain. I think this is mind-blowing, not to put a pun on it, but it is mind-blowing to a lot of people that something like socialization is really important for brain health. Can you explain the research behind this?
Socialization is important for so many things, being connected to other people. Socialization and our social connections are so important in childhood, and really have a role in forming the way that we think about the world and who we are. And there have been many studies that have found that social connections are important for brain health. I'll just say a little bit about a couple of them, but it's really quite a large body of research that has consistently demonstrated that being socially connected is important for the health of our brains. So there was one study that looked at over 10,000 people and followed them over time, and found that the level of social contact that they had at age 60 was associated with a lower dementia risk over the next 15 years.
Wow.
Another study that focused mainly on women found that larger social networks reduced their risk of developing dementia by 26%. And for those women that had daily contact with friends and family, their risk of dementia was reduced by almost 50%.
Wow.
And then I'll say that, there have been many studies that have looked at the opposite, and they've sort of gotten at the problem from the other direction, finding that individuals that are lonely or have poor or limited connectivity have an increased risk of dementia.
And that's not surprising because I think isolation is has been started. People are starting to, and researchers are starting to look at isolation as a phenomena and how it could lead to increased early death, increased challenges, and I think certainly there's not a listener on this podcast during this most recent pandemic that has not viscerally understood the challenge of social isolation. But I'd like to dig in a tiny bit more on how you define social connections, because I can hear the single older adults in my head saying, well, I'm not married, I don't have a partner. Um, what does that do me from a mental health perspective? Um, in the research, how define the social connections? Are they deep friendships? Are they loose connections? Are they a combination?
Yeah, so social connections in this body of literature certainly does not refer only to things like having a spouse or a life partner, or even having adult children. Really, these studies look at all different types of social connectivity that one can have, and so there are studies. Many of these studies sort of combine a number of different social categories to get an idea of social connectivity. So perhaps asking questions about marital status, and family composition, but also asking about contact with friends, contact with neighbors, socializing at church or volunteering. So there are many ways that people can be socially connected. There was at least one interesting study that I can think of centenarians, older adults that lived past the age of 100, that suggested that it is not necessarily the number of people that somebody comes into contact with that is protective, but the quality of the relationship. Having relationships in which one feels valued and supported.
I can hear all the introverts listening to this podcast take a deep breath saying, okay, I don't have to change my personality here. If I'm an introvert and I have just a few good friends, I'm okay from a socialization standpoint. I don't have to become a social butterfly and in order to help strengthen my brain. That is a huge relief for, I'm sure, a lot of folks. And as the older that you live, the more chances that you will outlive some of your peers. So I think it's important to recognize that social connections need to be continued to be developed at every age, and that you're not done making friends at a certain point in time. Another interesting lifestyle factor that I have heard you talk about is the quality of the sleep and the importance of sleep. And sleep being, we know sleep is important for so many reasons, but if you had to focus on a number of different lifestyle factors, that I think you would say that sleep is even more important than diet. And maybe I'm off base about that, but can you talk about sleep and how that plays into brain strength?
Sure. Yeah, I would say that, all of these lifestyle factors work together. So, if one piece of the puzzle is missing, just sort of focusing on another piece is not going to be as helpful. So, if somebody has a terrible diet but is sleeping well, that is not as helpful as sleeping well and also having a good diet would be. So, essentially, we want to just make sure that we're sleeping well, that we're getting 7 to 9 hours of restorative sleep a night, that we aren't sleeping too little or too much, that we are speaking to our healthcare providers about things like insomnia, not being able to get to sleep at night, uh, you know, uh, things like, waking up in the middle of the night multiple times in a way that is disruptive to our ability to get good sleep, or even things like waking up much too early in the morning, not getting those 7 to 9 hours because you're waking up early and not able to get back to sleep. Sometimes bed partners will notice things like that their partner is gasping for air in the middle of the night, or seems to be having trouble breathing, or is snoring excessively, and bringing those observations up to healthcare providers is important as well to help identify any sleep disorders that we might be able to treat.
And it seems that as you get older, it becomes more of an issue. Is that an actual fact or urban myth that the older you are, the harder it is to get a good night's sleep?
Yeah, so there are some changes in the sleep cycle that are sort of normal with age. Older adults take longer to fall asleep compared to younger adults. They may, have more sort of brief nighttime awakenings compared to younger adults. But older adults are also more likely to have sleep disorders, things like insomnia, or sleep apnea, where breathing is disrupted during sleep. So it certainly is important to be talking about these things with your healthcare providers.
That makes a lot of sense. Um, in your book, you talk about something called the mind-body connection, which I think is getting more and more exposure and play in the medical field. Um, and can you describe the mind-body connection, and specifically, how does that impact aging?
Yeah, so there's a couple of different ways I think that people think about the term the mind body connection. One of course is what we've been discussing, that things like exercise and nutrition and physical health impact the brain. But there's also another type of mind body connection that we refer to as mental mindset. And that refers to this really interesting body of research that looks at how perceptions of aging, how one thinks about the aging process, can influence how a person actually ages.
I love this. Keep going.
So, this literature essentially shows that people that have more positive views about getting older tend to age better over time. So, for example, there was a very notable research study that found that people that have more positive views about aging uh, are less likely to have a stroke or a heart attack compared to people that have more negative views about aging. Those with more positive views also tend to live longer. And the idea behind this is that when people have more positive views about aging, they tend to be more likely to be willing to engage in all of these kinds of proactive, protective activities that we've been discussing. When people have more negative views on aging, they sort of believe that, everybody becomes frail and sick as they get older. They tend to be less likely and less motivated to be proactive about caring for themselves.
I think that is fascinating. That literally, and I hope everyone is listening to this, that literally if you have a more positive attitude, research about aging in particular, research shows those people have fewer heart attacks and strokes. Just having a positive attitude towards aging, which is so revolutionary, I think, in our country that worships young youth and the energy of youth. And I love this because it says there is this connection that if you believe it, you can make it happen. And obviously it's backed up by the fact that if you have a positive attitude about aging, then you are going to, as you said, engage in trying to have better sleep, better exercise, establishing those social connections. But again, changing your attitude can have that literal impact on your lifespan. Um, and I think that is something we can all strive for. It doesn't mean that aging is going to be any easier. It is, as everyone knows, aging is not for sissies. But to have that attitude that you can always do a better job, that you're here on the right side of the ground, not the wrong side of the ground, that has a literal impact is fantastic.
Yeah, and I will say, I think that the most important part of all of these things that we've been talking about are that these are things that we can control and that these are things that we can change. We can change our attitudes about aging to be more positive. We can change our diets and our exercise habits. We can make sure that we're taking care of our physical health and our mental health. So these are all things that are within our control.
People who have listened to this podcast know that I like to describe myself as a control enthusiast as opposed to a control freak. But I am attracted to the fact that, it's not fatalistic. You have a certain body that you live in, you have a certain genetic composition that was handed to you. You can't change your genetic composition, but you can work on shaping your body and shaping your mind, um, to be more positive and to be more proactive about how to be healthier and how to have a better attitude, um, as you age. I think that is so important for every person to hear and to really start internalizing, because as a nation we mock people who are older. We don't give them credit. It is not a really positive place to be. So I think it is up to all of us to start changing that dynamic and that conversation. Um,
The other thing that I would just like to say that I think it is also important to acknowledge is that you can also do all of the right things, but none of these things that we're talking about will guarantee that you will not get dementia. And so, for people that are experiencing memory loss or have had diagnoses of dementia, it is certainly not because you didn't do enough. Uh, and I think that that is important to acknowledge. But the positive side of that is that even if one is experiencing memory loss, or is diagnosed with dementia, there are still choices that they can make in their lives to continue to have quality of life.
and I'm so glad you brought that up, because it's hard enough to deal with and understand a diagnosis of memory loss without having to pile blame and shame on top of yourself and say, well, if I hadn't done this and I hadn't done that. I think the important thing for everyone that's listening to this today, that is hearing about this and thinking about this, is what you said earlier. You have the ability to change your attitude, to change some of your habits, and to do the best with what you have. But it is ultimately, as in so many things, not our total control. So this is not a guarantee that it's going to help you avoid it. But it is saying that these lifestyle changes are positive and can give you some strong benefits. And if you're interested in changing your life and working towards a more healthful life, this is a good way to begin. Um, I have just a couple more questions. I can't not talk about the flip side of a positive attitude, which is, um, how does depression factor into aging and memory? And is there anything that you would recommend for folks who are struggling with that, as they age? Anything that you would suggest?
I would say, especially right now with quarantine and increased isolation from friends and family, people are at risk for feeling more depressed or anxious than maybe they did in the past. We know that when someone is feeling depressed and anxious, they don't think as clearly. And many people with depression and anxiety notice changes in their memory and thinking. So, again, the best thing to do is to tell the medical professionals that you work with if you are feeling depressed and anxious, because depression and anxiety are treatable conditions. And if the changes that you're experiencing in memory and thinking are caused by depression and anxiety, those difficulties will go away if the depression and anxiety is treated. So it's really important to not try to manage through these things on your own, but to really seek help from medical professionals and even start by, by telling friends and family what's going on.
And that's good advice because I think folks who struggle with depression are also um, ashamed and feel that this is something that they should be able to figure out on their own, and the whole stigma around mental health in the country is it makes it harder to talk about. So that's excellent advice. So if you were to sum up what you would recommend someone does if they are concerned about their memory, give us some recommendations. If one of our listeners is listening to this because they're worried they may have memory loss, be due to family history or whatever, what would you suggest they do this afternoon or tomorrow morning? I'm going to be very specific. We try to be extremely practical here.
Yeah, that may change my recommendation a bit.
Okay.
So I'll answer
Sweet.
that sort of specific question first. So if you were gonna, wake up to a new day tomorrow and start doing something, I would sort of suggest that you look at what you're doing for exercise and how much exercise you're getting. Look at your diet, sort of start by examining some of these factors and having an honest conversation with yourself about whether there are areas that you can improve. So, aiming to increase aerobic exercise so that you are eventually meeting that 150 minutes a week, 5 days a week, 30 minutes a day. And that can start by going for a walk. If you wake up tomorrow and you want to change and you're not an exerciser, start by committing to going for a walk, making sort of small, manageable goals. Looking at ways in which you can improve your diet, adding more fruits and vegetables and green leafy vegetables, and aiming to eat more fish and reduce trans fats and reduce your intake of sugar. Increasing your socialization. I know that is a difficult task during COVID. But even during COVID, there may be ways in which you can connect with people by phone or by video, that can increase your feeling of social connectivity. And certainly, maybe not tomorrow, but after COVID, which hopefully will not be too long before we can start to resume many of our activities that we've loved and missed, doing things like volunteering, joining organizations or social groups to increase social connectivity. Those would sort of be all of the things that, I would suggest, that one can do, starting tomorrow. Maybe not tomorrow, but maybe, within a couple of weeks or at your next annual exam, if you are really concerned about changes in your memory or other thinking abilities, it is critical that you talk about the concerns that you have with your doctor so that you can make sure that you're doing everything that you can to understand why your memory may not be as good as it was before. And that may simply be, that you're getting older and it's just normal aging. But it could also be that you have some mild cognitive concerns or perhaps even the beginning stages of dementia. But even knowing those sort of worst scenario cases early is very helpful in sort of planning the future and moving forward.
That's a great list. That is great recommendations. And it reminded me of a question that I know um, people will have when we talk about socialization. And I just want you to answer this one last question is socialization, does it count to be social online? So I'm not talking, I think there's a, and you can explain, I think there's a difference between Zoom, FaceTime with a person versus online social media. So, can you help us uh, determine um, if there are differentiations in the quality of social connection? First, first level being face to face, in person. Can you just talk about if there are differentiations in that in terms of again in terms of brain health.
Yeah, so I'm not sure that we know, but my guess would be that socializing face to face and socializing over video, uh, may be more comparable, may provide similar benefits. I think that certainly there are many other things that we get out of socializing face to face that include being in new environments, maybe even getting exercise, walking to a friend's or even walking from your car into, the volunteer, center that you are volunteering at. Um, I strongly suspect that socializing in via face to face or video or even by phone is much different than just getting on a social media platform like Facebook and looking at pictures and liking content. But I don't know that we know.
Okay, okay, that's my assumption, but we'll wait to see research come out for that. um, but it's been fantastic having this conversation with you, Dr. O'Connor. I just want to ask, is there anything that I did not yet ask you that you would want people to know and think about when it comes to dementia, memory, brain health?
Yeah, no, I think that we've covered it all. Just the bottom line of, there are many things that you can control about the health of your brain. Is the sort of important message.
That's awesome. And if you want to learn a little bit more about what Dr. O'Connor is referring to when she talks about your ability to change and enhance your brain health through lifestyle, please pick up her book, 7 Steps to Managing Your Memory, What's Normal, What's Not, and What to Do About It, which she co authored with Dr. Andrew Budson. It's available on Amazon, independent bookstores, and as Dr. O'Connor says, it's available in most libraries for free. So take a look at that and read it. It is a really positive look and review of what you can possibly do. And then if you do have someone in your family who is has a dementia diagnosis, um, pre-order her new book, which is 6 Steps to Managing Alzheimer's Disease and Dementia, which is a guide for families. So her 2 books really cover the gamut from what you can do proactively and then what you can do to help a family member who is struggling with this disease. And I love your recommendations of what all of our listeners can do tomorrow, the next day, and during their next physical exam. So I want to thank you so much for coming and sharing your wisdom with people who I think are, many of our listeners are probably breathing a sigh of relief and starting to put their sneakers on, hopefully by the end of this podcast. So thank you so much for coming.
Thank you so much.
That's our show for today. If you liked it, please remember to subscribe and rate Seniority Authority on your favorite podcast platform. And don't forget to send us questions. Even send us questions for Dr. O'Connor. Your questions shape our podcast. So if you have more questions, we will ask her to come back. And if you enjoy our show, please subscribe and spread the word. Until next time, let's get smarter about growing older. Thank you. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of nonprofit retirement communities, where active adults find community, purpose, and peace of mind. Visit riverwoodsgroup.org. That's our show for today. Did it spark a question? If so, send us your questions at seniorityauthority.org and we'll track down the answer. Meanwhile, don't forget to subscribe, like us on Facebook, follow us on YouTube, and rate us on your favorite podcast platform. Until next time, let's get smarter about growing older.